Niemann-Pick type C disease is by nature very complex, and it can look so different. And so it is hard to really pinpoint particular features of the disease that should give people a heads up that this could be Niemann-Pick. There are classic findings. The changes in vertical gaze, for example, are very classic with Niemann-Pick C, though they can be seen with other diseases. But that in combination with progressive motor or developmental decline, and also the presence of hepatomegaly or splenomegaly, those together should have people thinking very seriously that this could be Niemann-Pick C. The diagnosis is certainly easier to come by now than it was a decade ago. We have genetic testing that's readily available and biomarkers that are also readily available. And so with that clinical suspicion, I think it's important to very quickly go to the diagnostic studies. And from there, then it becomes a complex situation of, well, what do I do? And I think most patients, most families of the patients that are affected really, when they hear that the course is really unrelenting, progressive, want to have an intervention as soon as they can, whether it's going to slow it down or ideally be curative therapy. But we just don't have all the data yet to be able to provide that type of knowledge and intervention. But we do have, at least with the cyclotherapeutics, we have a very promising drug that we need to study in a way that can prove clinical benefit. We have a lot of experience in using it on a compassionate use basis. We definitely understand its mechanism of action, or are starting to understand its mechanism of action by a recent conducted phase 1 and phase 1/2 trials. But we really do need to now understand if this intervention will come forth with the promise that it has to show us over a 2-year period of time, which is a length of time that we really need to study given the rate of progression of disease, to really see if this intervention will have a change that leads to improved quality of life, that possibly halts certain aspects of the progression, or maybe even reverses some of the manifestations of the disease.